This video, we're going to talk about a family of gram-negative organisms known as the Enterobacteriaceae. So I began speaking about these organisms actually in the Robert May case. So I brought up Klebsiella in Robert May because remember that Klebsiella pneumoniae is often associated with pneumonia, specifically in alcoholic patients. So that was part of the reason we discussed it there. But I saved the bulk of the discussion on the Enterobacteriaceae for the Jenna Wilson case, just because the types of symptoms that we associate with the vast majority of the Enterobacteriaceae fit better with this case presentation. So the Enterobacteriaceae are the largest family of clinically important gram-negative bacteria. It's a really heterogeneous collection of organisms that cause virtually all types of infections that we see in clinical practice. So the Enterobacteriaceae include organisms that you've probably heard of before, like E. coli and certainly Klebsiella, which we discussed last time, as well as some lesser known ones like Enterobacter, Citrobacter, and Serratia. And then things like Salmonella, Shigella, and Yersinia. Yersinia, I don't go into great detail on, but Yersinia, there's kind of two variants. There's Y. enterocolitica, and that one is basically a gastrointestinal infection, but there's also Yersinia pestis, and Yersinia pestis is the causative agent of Black Plague, which killed, obviously, millions of people over the course of history. So all of these organisms belong to this same family. These are non-spore-forming gram-negative rods. So morphologically, they're all very similar. One of the things to keep in mind is that you're not going to want to confuse these with the Enterococci. We haven't discussed the Enterococci yet. We'll actually discuss them in your vital fluids and gases block. But the Enterococci are gram-positive rods. And these, or sorry, gram-positive cocci, it even says it in the name. And these are obviously, the Enterobacteriaceae are gram-negative rods. But for some reason, students have trouble making that differentiation, maybe because of the entero. But you're going to want to keep them straight. So within this family, even though it's kind of a diverse family of organisms that I've got listed down here, there are some common major characteristics. First off, Enterobacteriaceae are ubiquitous. We can find them almost anywhere in nature. They can be found all over the world, in the ground, water. They're considered normal flora of the human gastrointestinal tract, as well as those of various animals. They cause about 1/3 of the bacteremias, so presence of bacteria in the blood, and more than 70% of UTIs. So they're a really common cause of urinary tract infections. They can also cause gastrointestinal infections and be a major cause of bacterial meningitis, as many of you probably researched and learned about when discussing the Miriam Khan case. Some Enterobacteriaceae are normal commensal organisms and become pathogenic when they either acquire virulence factors or when they're transplanted from a place where they're normally allowed to be, like the gastrointestinal tract, to a place they're not supposed to be, like your cerebral spinal fluid. So as I mentioned, they're non-spore-forming gram-negative rods. They actually have a common antigen, and that's why they are all grouped in this same Enterobacteriaceae group. And this common antigen is enterobacterial common antigen, or ECA, that they all express. They're facultative anaerobes, so they can do aerobic respiration, but they are also able to live without oxygen. They grow really well on blood plate agar for the most part, but that's not where you're typically going to see them grow. Where you're going to see them grow is on McConkey agar. So McConkey agar is a selective and differential culture medium for bacterium. So remember that in your bacteriology self-study, I mentioned that there are certain types of agar that help you determine what type of organism it is because it tells you something about the biochemical properties of that organism. So McConkey is, first off, it's really only used for gram-negative rods. Only gram-negatives grow on MacConkey. So that's step one. So if you're getting growth on MacConkey, you've got a gram-negative organism. So right there, it tells you something about it without you even having to look by gram stain. The other thing it does is it tells you whether or not the organism can ferment lactose, which is a further biochemical property that will help you determine what type of organism it is. So when you look on MacConkey agar, and that's what's pictured down here, you can see that there are lactose fermenters like E. coli, Klebsiella, Enterobacter, Citrobacter, and Serratia. And when they ferment lactose, it lowers the pH, and that causes the agar to turn this pink to almost red color. So it's a nice pH indicator. If the organism is unable to ferment lactose or does it at an exceptionally slow rate, like Salmonella, then that's considered a non-fermenter. So Salmonella, Shigella, and Yersinia, they'll grow on MacConkey because they're gram-negative organisms, and gram-negative organisms can grow on MacConkey. They just won't change the color of the media. So it's a really nice differentiating factor there. The other thing that these organisms have in common is that they're all catalase positive, so much like our Staphylococci. All the Enterobacteriaceae are catalase positive. These guys, though, are oxidase negative. So why is that helpful? There's another gram-negative rod, Pseudomonas, and as well as Vibrio. We talked about Vibrios earlier. Both of those are oxidase positive. So if you find a gram-negative, lactose-fermenting, catalase-positive, oxidase-negative organism, you've narrowed down your tree of potential organisms in this disease quite a lot to kind of get a better idea of the type of organism you're dealing with. So let's go over the major structures for the Enterobacteriaceae. So first thing to remember, as I've said numerous times, these are gram-negative organisms. So if you think back to the bacteriology self-study that you received with, I think it was the Jamie Lopez case, the structure of the gram-negative bacterial wall is different from the gram-positive wall. So one, the peptidoglycan is thinner, but it also has LPS, or lipopolysaccharide. This is a heat-stable product in the cell wall that is actually recognized by CD14 on phagocytes or phagocytic cells, so monocytes, macrophages. And remember, CD14 finds LPS, or in the gram-positive organism, LTA, and it allows it to be phagocytosed. So what is LPS? Well, besides the fact that it's heat stable, it has three major components. The first is kind of the outermost polysaccharide, and that's O, so outer polysaccharide. Then there's the core polysaccharide, and that's common to all Enterobacteriaceae, and that's actually what forms the ECA. And then there's lipid A. Lipid A is what actually causes the inflammatory effects of LPS. So lipid A is what we're actually responding to when we get increased cytokine production, fever, all of those effects, those inflammatory effects that are associated with LPS are actually all due to lipid A. So whenever you have an organism that has an altered lipid A, you might not have this inflammatory effect, but the majority of the Enterobacteriaceae have a nice strong lipid A that's going to create an inflammatory response in us. So how do we detect the Enterobacteriaceae? Well, serologic identification is actually really important for our detection of the majority of these organisms. And we do it using O side chains and H. So there's also K antigens. I'll talk about that in a minute. But for the majority of these, we're looking at an OH serotype. And certain serotypes, certain OH serotypes, are associated with more severe disease. So those are kind of kept track of epidemiologically. So the O polysaccharide, or the outermost portion of the LPS, has strain-specific O antigens that are present in each genus and species. And there's a lot of cross reactions from as an antibody standpoint because the genera are very closely related, but they can still be used for identification purposes. So the K antigen actually has nothing to do with LPS. It has everything to do with the capsule. So many of these are encapsulated organisms, and these are type-specific polysaccharides. So we can make antibodies to them, but these are not really used for strain typing. Really, we used the O and H antigens, not the K antigens, even though we make antibody responses to K antigens as well. So the H antigens are actually H proteins, and they are actually, they come from the flagella. So these, again, they don't have anything to do with LPS. These are antigens that are held within the flagella. And these are also heat stable, which is great because then we're able to identify easily the antibody reaction that we would make them. So detection of these antigens actually provides a significant amount of clinical significance because, as I said, some of the more pathogenic species of bacteria are associated with specific O and H serotypes. So, for example, O157H7 is a particularly nasty variety of E. coli. So we keep an eye on these specific serotypes when we encounter them. Okay, so virulence factors. So some of these are shared across the Enterobacteriaceae and even across gram-negative organisms. So I already mentioned endotoxin. So endotoxin is actually the lipid A component of LPS. As I mentioned before, it fixes complement or activates complement, because that's what that term means. When you fix complement, you're actually activating it. You can get increased cytokine. You can get leukocytosis, thrombocytopenia. You'll even, if you have a high enough endotoxin amount, the patient can experience DIC, disseminated intravascular coagulation. Fever is common. Shock, even death can occur. So LPS is a pretty nasty byproduct of gram-negative cells. As I mentioned, a lot of these are encapsulated, and remember, anytime we're dealing with an encapsulated organism, that capsule is slimy. You know, I want you to think of like an egg yolk with egg whites around it, and you're trying to grab like a little piece of shell in the egg white. That's what a capsule is like. It's just really slimy, and you can't really grab that little piece of eggshell that fell in easily without something like an antibody. Antigenic phase variation. What do I mean by that? So I mentioned that we use O and H, basically antigen differences to serotype, right? So I mentioned that there was that one strain of E. coli, O157H7. So what does that tell you? That tells you that at the very least, there are 157 different antigen varieties of O antigens that are E. coli and 7 H antigens. And when these two are paired together, it's a particularly nasty bug, okay? So you've got these variations that we make responses to. And anytime an organism can make variations in the things that we have to respond to them, that's actually a virulence factor because they're changing it up so that our immune response doesn't see the same thing every time. So we can't easily make like a vaccine to it because let's say we made a vaccine to O1H1. Well, the first time you saw O1H2, well, now 50% of your antibodies are useless because they're specific for O1 and now you have, or they're specific for H1 and now you have H2. So anytime you have antigenic phase variation, that's good for the bacteria and bad for us. A lot of these guys have type 3 secretion systems. What does this mean? Type 3 secretion systems are basically a little bacterial syringe. So I want you to think of it like this. So your bacterium has this syringe that it's hanging onto. I'm going to give it like an angry face. This is our bacterium. And then this is our host cell, our happy little host cell. And he's just hanging out, excited about life. And this bacterium has toxins. And it needs to get the toxins into the host cell in order to either infect the host cell or to make the environment more hospitable to us, or to them, so that they can survive. Not hospitable to us, hospitable to them. So it has this type 3 secretion system that basically injects its awful little toxins directly into the cell, which is going to make our cell very unhappy and potentially kill us. So basically, that's a really long way of saying that the bacteria have syringes and are injecting our cells with products that either want to cause an immune response or cause them to die or produce something that's going to help make the bacteria happy. Okay, the other thing is heme proteins. Hemoglobin, myoglobin, and other iron chelating proteins like transferrin and lactoferrin. These basically allow the bacteria to steal things like iron and heme from us, which are helpful for them to grow, because there are some organisms that require a higher concentration of that. So it allows them to kind of sequester all of these things in the area away from us, our cells, and toward them. The other thing is, so anytime you hear the word enero, I want you to think about the gastrointestinal tract. Now, that is not to say that you won't ever encounter these organisms anywhere else. It just means that the gastrointestinal tract is a place that we kind of expect to find them. And sometimes expect to find them in such a way that they are not causing disease. Like, there are many of people who have normal carriage of E. coli in their gastrointestinal tract. It causes them no problems. In fact, it probably even helps them digest food and, other necessary functions of the gastrointestinal tract. But it means they hang out in the gastrointestinal tract a lot. And anything that hangs out in the gastrointestinal tract typically has pretty high antimicrobial resistance. So that means our antibiotics might be less effective against many of the Enterobacteriaceae. So those are the common factors that are associated with all Enterobacteriaceae. I'm going to make some videos specifically for E. coli and some of the other ones to take you through those. But the Enterobacteriaceae are kind of a large heterogeneous group. They're all catalase positive. You can grow them on McConkey because they're gram-negative organisms, and you can use that to help differentiate their ability to ferment lactose. And they have O and H antigens that are used for serotyping.